It's been established that we do have a quorum. Is there a motion to adopt the agenda?
So moved.
Second.
Second.
Been moved and second. All in favor? Aye.
Aye.
Very good. That brings us to item number 3, Milton's Transit Riders Association. Mr. DeChamps, is anyone available to speak?
No, sir, we don't have anyone to speak from Business Riders Association.
Mr. DeChamps, for item number 4, do we have anyone signed up to make a comment?
No, sir, we don't have anyone signed up to make any comments.
Okay, that brings us to item number 5, the consent agenda calendar. Is there a motion to approve the consent calendar?
Mr. Chair, I'd like to pull out the minutes for one minor correction. So I make a motion to adopt the other 2 items under the consent calendar.
Very good. Is there a second?
I second that.
I second.
Please call the roll, Ms. Bonner Reed.
Mr. Brennan? Ms. Teresa?
Yes.
Mr. Walker? Mr. Fergus?
Yes.
Ms. Gleason? Representative Howard? Chairman Huggins?
Yes.
Mr. Lawson? Mr. Lawson? I think we lost him. Ms. Mood?
Yes.
Dr. Morris?
Yes.
Mr. Smith?
Yes.
The motion carries.
Very good. Mr. Smith, would you please address the approval of the board minutes?
Sure. So I make a motion to adopt the board minutes with one minor correction on page 7 under the operating and capital budget section, item C. It says, there's a sentence that says, federal funding related to transit, which was previously covered under the CARES Act and it says not be covered under the American Rescue Act. I think I meant to say there now be under the American Rescue Act. So not should be changed to now. It's a minor correction, but I think it's substantive.
Very good. Is there a motion to adopt the change?
Do we just need a
So
second
moved.
to his motion?
He made the motion. So Dr. Mars, was that you to second that?
Yes.
Okay,
Yes,
very
yes.
good. All right, Ms. Bonner Reed, will you please call the roll?
Yes, sir. Mr. Brennan? Ms. Teresa? Councilman
Yes.
Walker? Mr. Fergus?
Yes.
Ms. Gleason? Representative Howard? Chairman Huggins?
Yes.
Mr. Lawson? Ms. Mood?
Yes.
Dr. Morris?
Yes.
Mr. Smith?
Yes.
Ms. Teresa, are you voting yes?
Yes. I'm sorry. Did you not hear me?
No, I'm sorry, I didn't. Thank you.
Okay. Mhm.
Yes, the motion carries, Mr. Chair.
Thank you. That brings us to item number 6, discussion items. Ms. Bonner Reed and Mr. DeChamps, would you please address the COVID-19 ad hoc committee update?
Yes, sir, I'll go ahead and start, and it starts on page 21. But first of all, just want to mention effective June 7th of 2021, the governor announced that the state of emergency in South Carolina was over. There was no executive order issued, so that's officially over. But basically, it does not change how the Comet is operating as it relates to our COVID policy. We will continue to follow TSA's mask requirement, which is effective through September 13th of this year. We continue, like I said, to follow our policy where we're requiring masks throughout the transit system. And so all of those things are still in place. We continue to do testing at Comet Central, testing and vaccination. Actually, Comet Central has been designated by DHEC as a testing and vaccination site. So we continue to do that Monday through Friday from 8 a.m. to 6 p.m. Also, too, we continue to promote free service to vaccination locations. The main focus on the past month, 3 months, has been Columbia Place Mall. They are scheduled to wrap up there, I think, this week, but we've been actively promoting that site also. Right now, anyone above the age of 12 can get vaccinated in the state of South Carolina. That's pretty much general, but we continue to do that. We continue to focus on achieving 100% vaccination amongst our staff here. So that continues. And I think the biggest focus, again, is continuing what we have been doing, even though there may not be a state of emergency here in South Carolina, to make sure that our staff and also our ridership is as safe as possible. From there, I will go ahead and let Ms. Bynum Reed continue on if there are some things that you want to emphasize, bring forward.
Thank you, Mr. Deschamps. On the update of the Don't Miss Your Shot campaign, on May 17th, we solidified a partnership with Uber and Lyft in cooperation with United Way of the Midlands regarding implementation of their vaccine transportation services in Richland and Lexington counties. The trips are capped at $15 per ride and at 4 and are available Monday through Friday from 7 a.m. to 7 p.m. Health Force is continuing to provide the Moderna and Johnson & Johnson vaccines at Comet Central. The vendor has reported more than 350, it was 379 when we did this initial report that have been vaccinated so far, and more than 77 have been tested. DHEC now has Comet Central as a designated vaccination site in their system, which should drive more traffic to that particular location for people needing COVID vaccines. I also put on here, in lieu of the Comet organizing vaccine clinics, one of the things that we have done was stepped up our efforts to make sure that the public is aware of the vaccinations available at Comet Central, as well as the Uber and Lyft partnership. And one of the ways that we've done that was we've refreshed all of our marketing collaterals, as well as worked with our ATP Dev to make sure that it is broadcast via audio on all of our buses. And that actually went into effect this morning. So there are announcements going out every 30 minutes to remind people that they can get their COVID vaccine shots at Comet Central, and also at the pop-up locations available in Richland and Lexington counties, and through Uber and Lyft. And we're also, it's not in this report, but verbally, we are going to be on Trey Taylor's Coping with COVID broadcast tomorrow. And I have invited Charles Aiken with Health Force, the people who do our vaccines, to appear on that program with me. And that concludes my report.
Very good. Thank you for all the hard work, everyone. I want to take a minute to thank the ad hoc committee for COVID. All the hard work that was done over the last year. And at this time, I'm going to ask Mr. Deschamps and Ms. Bynum Reed to pretty much keep us up to speed on what's going on with the COVID efforts. But we will not be meeting monthly at this time. We will convene only when Mr. Deschamps and Ms. Bynum Reed feels that the ad hoc committee needs to have a say in how on some direction. Ms. Mood and Mr. Fergus, would you like to add anything?
Yes, Mr. Chair. I would like to know, have we given our staff and employees a completion by date on this COVID shot? Since the federal judges now are saying we do have that authority.
Mr. First, this is Leroy. I did speak to legal counsel on this, and our position right now
Join the meeting.
is to keep encouraging any staff member that may not be vaccinated to get vaccinated, to do whatever we can as far as if there needs to be time off or whatever we need to do to make sure that's being done, but we're not in a position now to say that this is mandatory and that you have to be vaccinated by a specific date. And looking at basically what OSHA is saying and also the EEOC, it's best for us to take this position now unless we see something change from a state or federal level. And that was my update from my last conversation with legal counsel.
Mr. Chair,
Yes, sir.
I think we need to move on from that. If we're getting healthcare workers being made to get the vaccine and we are public utility and giving the shot out, that doesn't look good at all. I get see what Ms. Mood feels about this, but that doesn't look good at all.
Noted, Mr. Fergus, and I will make sure that I work with, and I will encourage you and I to work with legal to make sure that we're up to speed and doing what's appropriate. Ms. Mood?
Oh, I would just say, I mean, it's always preferable if people will do this on their own. I understand what Mr. Fergus is saying, because over time, we have had across the board, requirements for vaccines, safe, like childhood vaccines for children to enter school. So that's not a new concept for something to be mandatory. I'll point out, though, there always have been and are exceptions for medical and religious reasons. And so I think this is probably a question that we need to look at in more detail before we make just an immediate decision, but I think it's worth our exploring.
Okay, well done. Ms. Bono-Reed, would you please? Ms. Bono-Reed,
Mr. Chair,
yes.
I would, this is Robert Morris. I would also suggest to Mrs. Donna Reed and Mrs. Donna Reed to look into incentives for individuals who are being vaccinated at the Comet.
Okay, Ms. Bono-Reed, would you please work with me to have a meeting with Ms. Mood and Mr. Fergus, along with our attorneys and appropriate comment staff and RATDEL staff to figure out how we should move on this issue.
Yes, sir.
Thank you. All right, that brings us to item number B. Mr. Fergus and I had done a walkthrough of the Sumter and Laurel site, and we saw a few things from a security look that we should address. And I'm asking Mr. Lawson, with his logistics background, to work with several other board members to do an ad hoc committee on the best practices for security. Mr. Lawson would chair this committee, and vice chair is Mr. Brennan. Also is on this committee is Mr. Ratio. And I asked Dr. Morris and Mr. Fergus to be on this ad hoc committee also. And Mr. Lawson, would you like to make any comments?
Mr. Lawson, you're muted. Mr. Lawson, you're muted. Keep the phone number.
Hey, can you guys hear me?
Yeah, now we can hear you, sir.
Hey, I'm sorry, guys. I was muted. I had to call in because I don't have signal in here. Yeah, Mr. Chair, thank you. I would just love to get whatever information you have or you gathered when you did the walkthrough, and then I absolutely can address it at a later time.
Okay, very good. Mr. Fergus, do you have any comments?
Not at this time. Thank you.
Very good. Mr. Lawson,
Mr. Chair,
Dr. Morris, please.
through you to Mr. Lawson, when he gets the information, would he share it with the committee members?
Mr. Lawson?
Absolutely, sir. That's not a problem. As soon as
Very
I get
good.
it, I'll push it out to the group.
Okay, very good.
Thank you.
Thank you. Thank you. Thank you. Thank you for everyone serving on this committee. Mr. Ratio, did you want to add anything?
Not at this time. Thank you.
Very good. That brings us to item number C, reimagine the comment, a brief update, Mr. Harris.
Yes, again, thank you to the members of the board. I did have an opportunity to follow up with Jared Walker and Associates. We discussed just the next steps in the planning process, including the Lucius and Rivers Super Stop, welcoming back the community partners that were originally a part of our planning process, and what that would look like. And also from our previous discussion, I know Mr. Fergus, he mentioned, and other members of the board, looking at data. So we are currently developing our route analysis, which was presented to the board last fiscal year. And we're updating that document as we speak. And I hope to have that ready for you in order to present it to the board by our next meeting.
Very good. If you would work very closely with the service committee, especially Ms. Mood and Mr. Fergus, to make sure that we're in line with what their thoughts are and what the board has asked.
Absolutely.
Very good. Ms. Mood, did you want to add anything?
No,
Ms.
nothing. Thank you.
All right, very good. Thank you. And that brings us to item number D, progress update from RATDev. Mr. Bell and Mr. Smith.
Yes, good afternoon, Mr. Chair. Right now, we continue to work as planned with respect to our tech assessment. We have already targeted July the 23rd for our tech assessment to be conducted with final reports. And our staffing continues to work to the point where we are fully staffed to provide current service delivery. And we are also continuing to recruit for our turnover and promotions situations. I am happy to report that we did have our first job fair earlier this month. We have produced some great results. We have a partnership now with SC Works. This all came about with our new HR generalist that's on board. Her name is Courtney Cohen, and she has definitely paid in some dividends for us to help us maintain our recruiting levels. For the University of South Carolina, we've got 2 new buses that have arrived. They're here. We're coordinating right now a visit for university to come out and take a visit and look at them. They look wonderful, by the way. The color schemes inside and out look real good. And we have 2 more that are scheduled to arrive this week. And so the plan, of course, is still on track to have them all here during the month of July.
Any questions from Mr. Smith or Mr. Bell? Thank you for that update. At this time on item number 7, we do not have any motion periods at this time. And that brings us to progress reports. The first is my report as chair. I just want to tell everyone thank you for, especially the comment staff, for working during this transitioning time and working with all the service committee and finance committee members to make sure that we stay abreast of any problems or to move the system forward. That's my report. We do not have an intermodal update. We are looking very quietly at a couple of the sites that some board members have asked us to look at, and I will be able to work closely with those board members and give the full report at our next meeting on how that's progressing. Service committee update, Ms. Mood.
Mr. Chair, before you go there, could I ask you a question?
Yes, sir.
Could we include at the next board meeting, could we go into executive session to discuss the need for all the consultants that we have? And also, could you let us know the status on the general manager? Because RapDev had said that by the end of June, they think they would have the general manager in place.
Yes, sir. Do you want that update at the next meeting, or are you asking for an update on that now?
Well, if you have it now, fine. But if not, I think we could do it next board meeting.
Very good. I defer that to the next board member. I have been working with Mr. Smith on this position, and I will definitely make sure that we have an update at our next board meeting.
All right, thank you.
Thank you.
You want me to go ahead from the service committee?
Yes, ma'am, Ms. Moody.
Well, I would just say that the service committee is continuing to track very closely that the progress with the on-time performance, and because you can see from the material that we have that that's still looking very low, I think 40% at this point. But and we are following along the lines that Mr. Hubble reported in his report to the full board of all of the ways that they are going about trying to come to a better way of monitoring our on-time performance and making sure all the pieces are in place. So that's one of our, I would say, primary focuses. That's one of our key performance indicators. And we are also watching the ridership, because we were down some in the last month from the month before. So with Eric's help, we are monitoring that, and also we'll look to see if the now counting the riders with the fare box back in operation, whether that may give us a difference in the numbers that we are seeing there. The only other thing is that on the motions from the board, the service committee was working on trying to bring our key performance, our key personnel procedure in line with our policies. And at our last meeting, after talking with legal counsel, I asked the committee if we could defer action on that, because our understanding is that part of the work legal counsel is doing with RapDev is to look at the requirements of the contract and whether there are things that need clarification in that. And one aspect may be what's designated as key personnel. And so we didn't want to go through a process of trying to get a change in our procedure approved, only to really have to modify it to be in line with what the legal staff is working with RapDev on. So we've just deferred in our action on that until we hear from them. And I think that's it.
Any questions for Ms.
Unless other committee members have something to contribute.
Any questions for Ms. Mood? Thank you, Ms. Mood. I do appreciate service committee working with legal and how you all have worked over the last month to make sure that we identify the key performance indicators and meet those expectations, and also working with legal on how we're going to move forward with key personnel issues selection. Okay, that brings us to Mr. Smith. Mr. Smith, Finance Committee update.
Yes, Mr. Chair, Finance Committee met briefly this month. We didn't have any action items. We just conducted our monthly review of financial performance and progress towards DBE goals, and we're able to ask and get some questions answered. But overall, pretty unremarkable. Good meeting, but nothing, nothing special.
Any questions for Mr. Smith? Thank you, Mr. Smith, and thank your committee for working very closely with comment staff and keeping us abreast of any kind of finance issues. Interim, executive committee update. I'm gonna ask Mr. Lawson, Mr. Smith, or Ms. Teratio, is there any executive updates that you want to give to the board?
Thank you, Mr. Chair, for this opportunity. I don't have anything.
Very good. Mr. Smith?
Nothing here.
Mr. Lawson?
I second that. Nothing here. Thank you.
Very good. Thank you.
Mr. Chairman, I don't know
yes.
whether this is the appropriate place to ask, but do we have a plan for when we'll be moving more toward in-person meetings again? I know we'll probably need to have the virtual link for a number of people over time, but I didn't know whether we had in mind a date that we'd be, whether the norm would be in person and then those who need to be virtual would be, or we're just going to stay with what we're doing for a while.
Well, I'm glad you asked that because my thoughts are I'm going to poll individually and give all the board members a call, all advisory board members and board members, and just have a talk with them and just feel out how comfortable they feel, and I'll be willing to get that information in it before the next board meeting, and I will Ms. Bono Reed to make sure that we get that information out.
Thank you.
Thank you very much, Ms. Mood. That brings us to Mr. Deschamps and Ms. Bono Reed reports. Mr. Deschamps?
Yes, as you can see on page 56 through 61, you'll find a recap from each department area as far as projects and different things that were accomplished and worked on throughout the past month. Also, just want to inform the board that we did have our triennial review this past Monday. What the process is now is we're continuing to provide them with some additional documentations on some of the deficiencies that were identified there. We're hoping to have that completed, that first step, by this Friday. So hopefully the reviewer will have his report completed this Friday, and then from there he will send it to FTA region office, which will probably be another 2-week process. And then from there, we should get the final results and any findings that will be noted there. And if we get that by next board meeting, then that will be a part of that board meeting. But again, I just want to thank staff. And I'll break it up just a little bit this time. I like to thank staff upstairs and downstairs, because it takes a team effort when you go through a triennial review. So appreciate everybody working together, and Dr. Prince leading and coordinating the information. So just thanks to everyone, and we will keep you all up to date and hopefully update you during July's board meeting.
Good. Ms. Bono Reed, would you please make a note, especially for the minutes, that I do appreciate, and I'm sure other board members do too, appreciate all the hard work that went into the triennial review and working closely with everyone in the building to make this thing a success. So please note that in the minutes. Any other questions? Any questions for Mr. Deschamps from board members? Ms. Bono Reed?
Yes, sir. I submitted the community outreach report on pages 62 through 64. Of note, we participated in the 5th annual Juneteenth festival that was held at Dutch Square. And I'm happy to report that everything that we took out there, people took home with them. So that was a great thing. As any of you have ever done community events, a lot of times you bring back a lot of literature and materials, but people took everything, and we had the vaccination campaign, Don't Miss Your Shot information for them, and people were excited to see us out there. We also supported the Lower Richland community with their Juneteenth festival that was held at Congaree National Park with shuttle services. And I worked with Joey and McKelvey of RTP Dev, and he helped us make that possible. So those were the two big highlights as far as our community outreach. As things open up, we continue to be a part of those events. We also participated in Columbia Food and Wine event, which was a Soda Cap event. And it actually brought more people on the Soda Cap bus. And we're seeing, you know, a gradual increase of people riding the Soda Cap connector, which is a really good thing. And we anticipate doing more of that in the future.
Mr. Chair.
Go ahead, Mr. Fergus.
Yes, I was real excited and proud to see the Comet bus at the Juneteenth festival. It was a very large crowd, and I was shocked to see it there because I wasn't aware that the bus service would be there. So I was, you know, so Miss Bino Reed, I'd like to thank her for that effort.
Thank you, sir. And make sure this point is noted in the minutes, please. Any other questions? Any other questions for Ms. Bino Reed? Thank you. Review of board motions. You can look at those on page 65 through 69. Any questions about board motions? Okay, that brings us to item number 9. We do not have issues to go in executive session. So that brings us to item number 10. Is there a motion to adjourn?
So moved.
So moved.
It's been moved and second. All in favor, aye?
Aye.
Aye.
I'm gonna ask Mr. Fergus, would you please give me a call after the end of this meeting, please?
Yes. Mhm.
Okay, very good.
Mr. Chairman, it's Barry Walker. Mayor
Yes, sir.
Walker. Would you give me a call, please, at your convenience?
Yeah, yes, sir. What number can I reach you?
803-206-2644.
I'm sorry, say it again.
803-206-2644.
6644?
No, 803-206-2644.
2644. Got it. Got it.
And
Thank you.
I'll make a request for a call too, please. Pam, would you give me a call when we get off? Thank you.
Very good. Thank you. Thank you, everyone. Have a great day. All in favor, aye?
Aye.
Aye.
Have a great afternoon.